Sirona Implants od wielu lat z dumą wspiera Polską Akademię Stomatologii Estetycznej. Również w tym roku jako diamentowy partner jesteśmy obecni tu w Sopocie. Każda konferencja PASE ma trochę inny charakter, jednak wspólnym mianownikiem jest bardzo wysoki poziom merytoryczny wykładowców. Dlatego bardzo się cieszymy, że mogliśmy zaprosić do Polski praktykującą w Paryżu i w Londynie dr Anne Benhamou, która podzieli się swoimi doświadczeniami w zakresie bioregeneracji. Ta konferencja to niebywała okazja do spotkania wielu lekarzy i techników, którzy w swojej codziennej praktyce wybrali produkty Sirona. Dla wszystkich przygotowaliśmy wiele ciekawych nowości, które prezentujemy na naszym stoisku. Dodatkowo mamy specjalną niespodziankę, która choć na chwilę pozwoli oderwać się od rzeczywistości. Serdecznie zapraszamy. For you as the clinician, what are the most important factors when choosing the type of biomaterial?
Two things. The first thing is that I want the biomaterials to be approved by the scientific literature about his osteoconductivity properties and about his biodegradation. This is very important. And then, of course, I have the handling. I mean, as a clinician, I need to know the product and I need to feel it and to use it properly.
Yeah, and is there any particular type of biomaterial you prefer? I mean, xenograft or semi-synthetic?
As you will see in my presentation this afternoon, I use bone substitute biomaterials regarding different indications. Mm-hmm. And yes, I do use xenograft and I do use semi-synthetic materials as well.
So in which clinical situation you would use semi-synthetic material, like for example, Symbios biphasic?
So Symbios biphasic, it's semi-synthetic materials because it comes from the red algae, from the sea, which has very comparable properties as human bone. So it's a very interesting material, and I think it's very good for the patient because they all use it for skin or antivirus, or so they know it. When you say to a patient, I'm going to use a bone substitute, they all start, what, where does it come from? And so when you say red algae from the sea, you say, oh yes, I use it for my hair, I use it for my nails. So the first step is already done with the patient. Then, for us, it's a very good material. His properties are very similar to bone in terms of biodegradation, like autograft. So I use it exactly if I was using an autograft. Mm-hmm. So mainly in sites where I have still the bone, the buccal bone, and so it's going to act like autograft, or I use it a lot for socket preservation after tooth removal, or in the sinus, a lot.
And what about Symbios xenografts? Are there still some situations where you use only the xenograft material?
Yeah, the Symbios xenograft is quite new. I'm just learning to use it. And actually I find that it's a very good material because it's very porous. And as soon as you mix it with blood or a saline solution, it becomes, all the particles are hold on together, and it's quite easy to use. You have no particles going away, and I use it for sites where I want the support longer. That's why I'm using it with collagen membrane, of course, but I'm using it in fenestration and dehiscence a lot, and this is approved by scientific literature. And I'm using it for GBR, guided bone regeneration, when the site is already healed for a long time, and that I need to create a new volume of bone, and so I need the support for a long time.
Yeah, you mentioned the collagen membrane. We hear from our customers very good opinions about handling of our Symbios membrane. What is your opinion about this topic?
The Symbios membrane is something very important to me because it's a resorbable collagen membrane who behaves like a non-resorbable membrane. So she has everything to be the best because we don't need to reopen the tissue after using it. It resorbs in, I think, like 9 months, 6 to 9 months. So for us, it's very important for the kinetics of resorption. And so it's there until the new bone formation has happened.
Today, with so many types of biomaterials, so many techniques, it might be quite confusing for the young surgeons which way to choose for themselves. What would be your advice for them in order to be successful?
I would say that the young surgeon, they should use what is working on their hands. You know, you're always good with what you know how to use. So they have to know what is good and then to learn to use it. And I think that with good materials, like for example this membrane, Symbiose membrane, or this xenograft, or even the Symbiose biphasic bone graft material, I think that they are good materials that they can learn to use it, and then they will have no surprise, because they are very good material. They have no surprise on the result.
How do you see the future of bioregeneration and biomaterials?
I think that the time of bone grafting, only bone grafts, well, for my field, as you know, I'm a clinician focused on aesthetic, so on the aesthetic zone. So it's a very small area, and for this very small area, most of the time, if we have choice, I would not use bone grafting anymore. I would use bone regeneration, and so I think that we have huge, and even for the sinus or even for other sites in the mouth, we really need bone regeneration. What I like with a material like Symbiose biphasic is that it's a kind of restitutio ad integrum. I mean, you are regenerating the bone really like your bone. And what I like with the xenograft is that it's supporting the tissue until we have new bone formation. So I think that we are now quite happy with what we have in terms of regeneration, and we don't need any bone grafts anymore. I think we have a great future with all these materials.